I'm Dr. Deborah Dantzler, Chief Geek here at Geeky Clinicians Podcast. Welcome, welcome, welcome. On this week of Geeky Clinicians Podcast, we have the honor and the privilege of having Eric Groh with us as our guest. And before we jump into a conversation with him, I'm going to let the other Geeky Clinicians introduce themselves.
Hi all, I am Jacinta. I'm a lead clinician and lead geek.
Hello, everyone. My name is Mona Taki. I am a first-year postmaster's resident, and I am the geeky clinical yogi.
I am Beth Burmester. I did an internship with 3D psychotherapy in my master's program at Agnes Scott, and I graduated in May and am just beginning the postmaster's resident program, and am the newest, I guess, geeky clinician.
Yes, welcome. And so, as I said today, we have the honor and privilege of having Eric Groh as our guest. So I'll tell you a little bit about him. Eric Groh is recognized as one of Georgia's premier ethics trainers for mental health professionals. He has presented at prestigious institutions such as Emory University's School of Medicine and the Licensed Professional Counselor Association, along with various mental health and addictions organizations. Eric is also a three-time governor appointee and former president of the composite board of professional counselors and social workers and marriage and family therapists. He has served as an adjunct professor at Georgia State University, Chattahoochee Technical College, and Barter College. Additionally, he consulted for the U.S. Department of Public Health to enhance mental health and substance abuse services for emergency responders during large-scale disasters. With over 20 years of experience as a solo practitioner, Eric combines innovative approaches with strategic practice development, focusing primarily on mental health care professional ethics consulting. Thank you so much for being our guest today, Eric. Welcome, welcome, welcome.
Well, again, thank you for having me. Yeah, it's really an honor to be here. I didn't write that, by the way.
It's great.
Yeah.
and so we actually met. I don't know that you remember this. I think I became fully licensed in 2008. So we probably met around 2008, 2009, when you were speaking at an LPC conference and you were doing your ethics workshop. And I was like, and so that's how long ago.
Okay.
I've been a fan, I guess. I'll say that.
Okay. Well, thank you for coming to the workshop.
Yes. So, Eric, when we have guests here on Geeky Clinicians, which Geeky Clinicians is a community for clinicians by clinicians that get geeked up about the work that we do, we always want to know, what is your origin story? How did you get started on this clinical journey? What first got you interested, and what actually got you interested in really specializing on ethics, your journey?
Well, I always say, none of us sat on the front steps with our friends and said, I want to be a therapist when we were 5 years old. So I think similar to a lot of us, I had an interest in it to try and figure out my own family. So then I went on to graduate school and, from there, got my license and started to practice in a variety of settings, Grady Memorial Hospital, Fulton County Health Department's HIV clinic, and a lot of other things. Again, the teaching, emergency on-call work at hospital emergency rooms. And then I went out into private practice.
Okay, awesome. And so kind of got into it through kind of the organic kind of graduate school, and then worked in a variety of different places. You mentioned the hospital, and then you made the shift to private practice.
The leap,
The
right.
leap,
I
yes.
made the leap to private practice. And the way I did that was, I talked to my wife about it. She was working, she had health benefits. So she's always worked both to bring money in, but also I couldn't afford health insurance, right?
Mhm.
So she said, go for it. She said, I know you're burned out where you're working, with the county. So go for it. So I left and I immediately started paddling and uh, gave a lot of talks at Emory University School of Medicine, connected with their Rollins School of Public Health, and then got these adjunct teaching positions. So did anything I can just to bring some money in and then get exposure. And then after that, um, when I was working one of these on-call emergency room jobs, it was actually uh, for Ridgeview.
Hmm.
And a psychiatrist there, I asked him, I said, are you looking for a therapist? And he said, well, not really, but I can give you the name of someone who I think would want to have you. So I did. I got with a psychiatric practice and basically saw clients through the practice and got credentialed with managed care and used that setting to jumpstart my practice. Took my clients with me, had my insurance contracts executed, and opened up an office. So that's basically that took 3 years from the time I left the county. That took 3 years.
Okay. So Eric, one of the questions that we ask is, what has been one of your biggest challenges as a clinician?
I think going out into private practice,
Mm-hmm.
because once you do that, it's no looking back. If you look over your shoulder or if you stutter step, you're not going to make it, say. So I would say, yes, that going into private practice, but
Nope.
well worth
Well worth it. Excellent.
it.
Any questions for Eric?
Yeah, I guess.
Go ahead. Go ahead.
You sure?
Yeah.
Okay, I guess I'm curious with the specifics of the challenges of going into private practice. Like, I know you said it was well worth it, but what were some specifics? Because those of us who are coming into the field and we're new and we may have dreams of having our own private practice, I'm just curious, what are some specifics of those challenges?
Okay. I'll use an analogy. If you want to become, I don't know, an executive with a company, you're willing to start anywhere. So you start in the mailroom or you sweep the floors. It was that. I was willing to do anything to get there. I didn't have too much, I didn't have too much pride to do anything. Yeah.
Okay.
But really
Yeah.
being open, being willing, and really being scrappy. Yeah, I
Oh,
love how you
yeah.
said earlier about you really kind of put yourself out there. You went out, you reached out to making those connections and then got connected with that psychiatric practice. That's wonderful. I'm just
Right.
curious on your timeline, you are a three-time governor appointee to our composite board, right? Like we are so
Okay.
privileged to have you here, right? Was that like on like once you went into that private practice world?
Okay. I definitely like to talk about my journey and experience while I was appointed to the
Mm-hmm.
composite board because this is the most, I think, interesting information I can provide, above and beyond, private practice and that I specialized in dissociative disorders, pretty much all my career. But, okay, when I left Fulton County, one of the things that I did, so along the same lines, Mona, is I went to LPCA of Georgia and asked them for a board position. I said, anything, whatever you got on the board. So I ended up being voted on as, at the time they had a diversity chair. So I was appointed to that position. And then LPCA had no staff at that point. All they had was a board, right? So we got enough bread together to hire a part-time executive director. Well, I decided that I wanted to, again, I needed the money. So I decided I wanted to throw my hat in the ring for that. And when I did, someone else on the board also applied for that part-time executive director position. And we were both told, well, you need to come off LPCA's board because there's a conflict if you remain on the board. So, I relinquished my position. The other person relinquished their position, and they interviewed folks for the job. I didn't get the job, but the other person who applied, who was actually the president at the time, was upset because they felt that they'd been contributing to the organization for a long time. And so they were upset about it. And I went to the board and said, hey, can I have my position back? I'm happy to serve anywhere. Back on the board, on LPCA's board. And they said, sure. And I didn't come back on the board. I think it was a matter of timing. Maybe they just needed to have another board meeting to vote me on there. But I received an email from the governor's office. And the email said, the governor would like to know if you would like to serve on the composite board of professional counselors, social workers, and marriage and family therapists. So I talked to a mentor I had, and if there's time, I'd like to get to talking about him because he was also my supervisor towards licensure. But I talked to him about it. I said, it's volunteer, and the first thing he said was, you can't say no to the governor. So based on that, really, I took the appointment, and so it was essentially, I had this opportunity with LPCA, and I just spun it into something. And I always say that I don't believe that I had necessarily more opportunity than the average person. It's just that every opportunity that I got, I wrung the most out of it that I possibly could. So I'd like to talk more about the board appointment, but maybe it would be helpful if some of you could prompt me from what I've told you so far. If you have any other questions, then it might help me know kind of where to take the conversation from here.
Okay.
Because there's so much interesting things to share.
Okay. Questions for Eric?
It sounds like there's a lot I'm sorry, Beth. It sounds like there is quite a bit to share. I was wondering about the ethics component with everything else that was going on. what caused you to log on to ethics
Okay.
and say that is important, that's what I want to do?
Okay. My first board meeting, the board also needed a person to process what they called at the time cognizant board members who processed board complaints and consumer complaints. And I didn't know how to do that, but I took it. I said, yeah, I'll take it. And the investigative committee, I think they call it something else. Anyway, it's made up of a professional counselor, a social worker, and a marriage and family therapist. So I took that position and started to process these complaints and found that I had some pretty good analytic skills for looking at these complaints. And a lot of these complaints, they would come in, there would be 100, 150 pages. And so I figured out really quickly that I could not read all of this, right? In other words, I had to sift through the therapist that I'm complaining on was wearing a green shirt and blue shoes and had such and such for lunch. See, so all of the extraneous information I had to quickly sift through and get to the essence of the complaint. And as I process these complaints, and the way that works is during the board meeting, the 3 investigative committee members will get in the room. The Secretary of State's office. A Secretary of State provides support staff to the licensing boards, including the executive director. Department of Law provides the board attorney through the Attorney General office. So the board attorney would be there, and the executive director, maybe one other staff member. And when the complaints come in the door, they're assigned a case number. So they would bring the complaints down, and one by one, we would go through these complaints. And again, the board attorney, they were there. What was really nice about this experience is it is by far the most respectful environment I have ever worked in.
That's awesome.
The board attorney literally sat there and said, let me know what you need. So it might be something like, okay, we want to take such and such action against the license. Can you go through the law and determine whether the board can do this under the law? So, at the time, we were working out of bound books, okay, which I think they probably still do. It's so much easier to flip through pages in a book as you're going over law. So we'd go through the law and we'd read a section, and I may cover my hand and say, okay, read this phrase. And the board attorney would read it. I said, okay, now read this phrase. And they'd look at it and say, oh, right. Yeah, you can do that. So this is generally, at the time, how what were called assistant attorney general served the licensing board. Okay, so we'd review the complaints. Some of them we would close. Maybe there would be a fee dispute, something like that. But others, we would call the licensee in and ask them questions. And based on those questions, the board may close the case, but if there appears to be a smoking gun somewhere, then the board has a lot of resources, right, to investigate these complaints. The board we didn't just read the complaint and then with a stroke of a pen make a decision. So often, we'd instruct the Secretary of State staff to contact the licensee and say, schedule an appointment, ask them to bring their records on this client. We may ask the board attorney to subpoena the records if the licensee was refusing to provide the records. And we'd interview the licensee, and if it seemed like there was more going on with this complaint, we could ask an enforcement agent from the Division of Enforcement to go out and interview witnesses, surveil the practice. And these enforcement agents, they're a lot of them were retired GBI agents. And they carried guns, they carried badges, and they went out to the practice. And so I would rely on all of these resources, right? In other words, for example, with the enforcement agents, it might be as simple as getting on, having the executive director, would you get the agent on the phone for me, please? And then get on the phone and simply ask the agent, who did you interview? Were they credible? Agent said, yeah, I think they were credible. Good enough for me. So everybody did their job, right, with these complaints. But now in terms of the ethics, I noticed that as these complaints are coming in the door, right, I'm reading these and seeing that there could be 20 different complaints that all looked very different, and they would all turn out to be boundary issues. Whether it was advocacy work, competency to practice, do a relationship, any number of things, right? So it was really then that I decided, okay, at whatever point I come off of this board, I'm going to take this information to my peers because no one else was doing it. No one else had done it before. No one else has done it since.
Nope.
And, part of the reason for that was when you are unappointed to the board, or it's very unceremonious. You get a letter saying, thank you for your service, blah, blah, this and that. We want you to enjoy your time with your family, just this kind of thing. And so there's no going away party. You are back out there with your peers. So this is why I focused on ethics, because at that point, I had processed hundreds of complaints, and there were periods when the board was underappointed, and there would be no social worker or marriage and family therapist. So I was processing all the complaints against all three professions, and I would go up to the executive director's office and pull some of these complaints, pull the files, and do research on some of these complaints, and just things like, what are we seeing most often? What types of complaints? When are they closed? Things like that. So anyway, it was when I came off the board that I said, I'm bringing this to peers.
So then did you actually help to write the ethical guidelines for the state?
Good question. The board is charged with enforcing our practice law and protecting the public. That's why we're appointed. The board is charged with writing rules to interpret that law. The rules can't violate the law, but the board has a lot of discretion within those rules. So yes, I wrote a lot of rules, right? So naturally, as these rules that you see, these rule changes coming out, I'm looking at these rules and saying, okay, yeah, I know why they wrote this. I know why they wrote that. Oh, they should rewrite this. It reads awkwardly. So yes, I have a lot of experience rules writing. And again, it's something that I would do in collaboration, usually sit with the board attorney who I actually became, we got to be really, really close friends. He was an actor on the side. And so I would go see his plays, and we just had a very casual relationship. So, uh, so yes, yeah, writing rules. Also though, I gained a lot of knowledge about other boards and other board processes, mainly again, because I was curious. I was curious, I was precocious, and so I would leave the conference room where we'd be reviewing applications, which is the bulk of the work that the board members do. And that's review licensing applications. So I would leave the boardroom and go upstairs, right? Maybe I ran into the executive director of the dental board in the elevator. So I'd go up there and plop down in her office. And, we would talk about the dental board and ask her, what are the most common complaints against dentists? And at the time, she said that mostly they're complaints from physicians for dentists performing maxillofacial surgery. So physicians thought, okay, now you're doing surgery. What this reconstructive work you're doing on the mouth and face, we think is surgery, right? But most of the time, and this is how most of the boards are, they really didn't get anywhere with it because what dental scope of practice in the law and in their rules said that dental has a right to regulate their licensees as they see fit, right? Same with executive director of nursing board. I asked her what are the most common complaints against nurses. Now this is going back quite a few years, and the most common disciplinary action against nurses was what they call diverting fentanyl.
Oh.
Diverting fentanyl.
Right. In other words, well, I'm not going to give it to the patient. Let me just put it in my white coat pocket.
Whoa.
So, like the show Nurse Betty.
Right.
Yeah.
And it was true also for, physicians, impaired, professionals. A lot of times it was diverting medications. So, I like to share that because that one piece of knowledge, within that one piece of knowledge, you learn how long fentanyl has been around, that it's legal, that it's not a street drug, and this is one of the ways the drug made its way to the streets. See, so I would go down to the director of enforcement and we would talk, or we'd go out to lunch. And I remember one time she said, I can tell you in which counties to commit a crime and it can't be traced.
What?
And I said, how can that be? She said, improper fingerprinting procedure.
Wow.
In other words, when you print, you have to roll from nail to nail. And there were some counties that weren't doing that. So a lot of that evidence, an attorney would represent someone who was accused of a crime, and that evidence wasn't admissible. So again, it's another example of just being very curious, being very curious.
Eric, I have so many questions for you. I don't even know how we're going to fit all of them in. I know, Beth, you had a question, so I want to get back to you. And then I'll come back to my questions.
Okay, so my question, well, yeah, I've got lots of questions too. But my first question was, as a member, former member of the composite board, and with your experience reviewing the new applications for licensure, what advice do you have for recent graduates in clinical mental health counseling who want to be LPCs when they're submitting or thinking about what they need to do for submitting those applications for licensure?
Okay, it's much easier for me to talk about my experiences when I was doing this, because every license application is different. Everyone is different. I remember getting applications in the door where, and they would come at the same time. Same employer, same job title, same supervisor. One would get denied, the other would get approved. So every application is different. It can be anything from simple administrative errors to someone just submitting a poorly assembled application. And so the board takes a look at that, and you have to take, since each application is taken individually, and I'm going to get into something about complaints in a minute. Excuse me. The board has to look at that and evaluate it on its own and make a decision whether to approve it or to deny it. So, Beth, to answer your question, it's when licensees or applicants or APCs contact me, I'll explain that what I can offer in terms of answers to general questions are not really going to be of use in your situation. I need to see everything you have, right? So whether it's an application, letters from the board, all of that. And having written those letters, I can review those letters and know. I remember being contacted by executive director by our professional association, and a licensee had come to them for help with deficiencies on their application. And I said, send me the letter the board sent. I looked at the letter, I called her back, and I said, the board doesn't want to issue this license. And she said, well, how do you know? I said, just having evaluated applications and having reviewed so many applications based upon what they're asking for, the board does not want to issue the license. So every application is different. So I'm going to give you an example, a little story here about processing of particular complaint that came in. The board received 8 complaints from 2 psychiatrists and 6 therapists against a licensee for practicing equine therapy. I don't remember the full nature of the complaint at the time, right? But you would think, well, 8 complaints, there must be something to this, right? But as I went through the complaints, first of all, they were all literally photocopies. So they were all identical complaints, right? So the first thing I'm thinking is, okay, this sounds like an employer-employee dispute.
Mm.
So we called the licensee in. I don't think I asked them more than 5 questions, said thank you, and closed all 8 complaints.
Wow.
So it doesn't always happen that way, but that's just one of the many different interesting scenarios that I would encounter just through the course of doing work with the board. You had a question, Deborah?
Yeah, just what you just mentioned actually kind of goes well with what I was going to ask in terms of, I would imagine that going through that many complaints over the time of your service there, you probably saw some things that were, I don't want bizarre. Like, what was like kind of the most challenging complaint scenario that you
Okay.
had to deal with? And then
Yeah.
maybe even what was the most rewarding outcome of a complaint scenario that you had to deal with?
Okay. I can tell you. Towards the end of my appointment, there was a complaint that came in against the licensee. It was an allegation of sexual misconduct. Sexual misconduct, in the intercourse, and right. So the licensee admitted this to law enforcement.
Mm.
Now, what a lot of people don't know is sexual assault of a client is a felony in Georgia. So hopefully this doesn't happen to any of you. But if you're ever accused of this, first thing, hire an attorney. So anyway, so the complaint came before the board, and law enforcement wanted the board copy of the board investigation. The board never released licensee files or records. It's just something we didn't do. Psychology didn't do it either. Never. And I felt very strongly about that for obvious reasons, right?
Mm-hmm.
If any of us had information in our file that we didn't think someone should have a right to, we wouldn't want the board to release it. And most of the board, in fact, all of the board, voted to release the records to law enforcement. And at the time, I had said, let law enforcement do their job. That's not the, and this is a fact. Boards don't involve themselves in criminal charges, purely the regulation of a license. So, for example, a board complaint may come in and someone is being sued and they have a board complaint. The board doesn't concern itself with the suit. Had a supervisor come to me, said, hey, I've got a supervisee that's suing me and they've got a board complaint pending. So, does that answer your question?
Yes, yes. And the most rewarding outcome, like, was there ever one that you felt like this, like, resolving the complaint really was like, like you really kind of helped the person, like that they really were maybe unjustly in this process, and then getting them the resolution or through the investigation, you were able to kind of like, what was the best outcome or something?
Okay. So, Deborah, you've been to my ethics workshops.
Yes.
There's an irony. Having been on the board and processing so many complaints, I have never filed a complaint against a peer.
Mm.
Because as soon as you do that, you're putting, not only are you placing a peer in the line of fire, but you're also you've embedded yourself in that process as well as a complainant. So yes, I can think of another example, and again, it addresses what you're saying, because I felt very strongly about innocent until proven guilty.
Mm-hmm.
This work is already very difficult. After this, I'm going to get to something really important about a conversation, about a situation that came up with the Secretary of State
Okay.
at the time. It was Karen Handel. All right. It was a situation of a person who had a complaint. It was a boundary crossing, was the nature of the complaint. It was that they had this kind of they kind of had their clients, I don't know, sort of in a way working for them under this kind of loosely structured organization. It was kind of a weak case, but the complaint lingered around at the board. It was at the board. It was on the board's desk before I was appointed, and then I got there, and it lingered around another year.
Mm-hmm.
And a couple of the board members felt that the license should be suspended. And I said at the time, I don't see any there.
Mm-hmm.
I think we should close the case. Well, I got outvoted in that situation. The board attorney, the licensee took it to court, Bibb County Court, which is where, if you want to appeal, that's where they're adjudicated. And the judge said, and this never happened either, that the judge would find against the board or tell the board to do something different. But the judge said, I think you need to close this complaint. So the board attorney comes back and said, okay, what do you want to do about this? The board didn't have to close it, but the judge said, hey, kind of think you should close it. So the board then, after 2.5 years of this complaint languishing away, we finally did close the complaint. So yeah, there were a lot of situations where I felt anything he said, she said, or he said, no, I need to see the smoking gun. So I always, even though I was charged with protecting the public, part of protecting the public is a good therapist can't be taken out of the pipeline of therapists who can help members of the public, right? Another situation the Secretary of State at that time had wanted to make all board complaints public, just the complaint.
Wow.
So the executive director of vet, of dental, of psychology, and myself got together and decided that we were going to contest this. And so we all went to the Secretary of State and said, this can't happen. This can't happen. I said, especially for psychology board and for composite board, because we're already getting a skewed group of complainants, right?
Mm-hmm.
And so she backed down with it. And that's it. It never came up again. It never came up again.
Ooh, good.
I would say there's too many to make them public.
I'm sorry?
I said it would seem that there would be too many complaints to make them public.
Well, all they would have had to do is put up there, complaint of sexual misconduct and nothing else.
And
See,
that's
yes,
enough
it would have
to,
taken a lot. That's right.
yeah,
Right.
the damage would be already done.
Because
Right.
to the public, it's guilty until proven innocent. That's how it is. Whether we like it or not, we are held to a higher standard by the public than other professions. So,
Well, I think that if I'm researching a therapist and I see a complaint like that, I'm not even going to care if they're guilty or not. I'm not going to them.
right. Right.
Yeah.
And to take it a step further,
Mhm.
When a peer or a supervisee comes to me, and sometimes supervisees can get preoccupied with what someone else in their office is doing that's unethical.
Hmm.
And sometimes they'll say, well, several people have said that they're in a relationship with this patient. And I will explain, an allegation like that, you better have witnessed it firsthand if you're going to file a complaint. You can't go on hearsay. So,
Yeah.
so I worked very hard for licensees and advocated for licensees. I think more than the average board member.
Yeah.
And at the same time, again, protecting the public, because I do remember a complaint. An individual wanted to be licensed, but they had a criminal history,
Mhm.
a violent criminal history. And long story short, my feeling at the time was this person wants to work with teens. We don't know if they're going to do some kind of tough love thing. Say, we don't know if this person is safe to practice. They have a criminal background. My feeling was, hey, find another profession. See, it was a series. It was homicide, and there are certain things that I felt don't issue a license. Any case where a licensee admitted to having sex with a patient, and the way the law reads is consent cannot be used as a defense, and a client can't consent with a
Right.
therapist because of the power differential. And I always felt in those instances, find another profession, revoke the license.
Yeah.
Because when I would orient new investigative committee members, one of the first things I would say is, remember this, there is the same rate of deviance amongst our licensees as there is in the general population.
Yeah. I love that you were so compassionate towards both the licensee and balancing that with protecting the public. And I know that when you said earlier that you really can only speak from your personal experience and your time in service to the composite board. But here in 2025, there are so many things that are different than when when we first became licensed, right? So when you filled out your application for the podcast, you put your license number there, and I was like, oh my gosh, right? It's not too, like I was licensed not long after you, but
Right.
the 4 digits, right? Now people are in the
Right.
5 or 6 digits or whatever, but the idea of the things that are happening now, ethics related to social media, of course, obviously there's telehealth. There are things that just are impacting the field in a way that were not relevant for us back then. And
Right,
I
right.
know that, so I just kind of want to get your take on anything related to kind of what's
Definitely.
happening in the present. One of the things is, um, you mentioned boundary violations and things like that with the complaints that you had seen. Obviously, like, we don't follow our clients on social media, we don't let our clients follow us, and those sorts of things. But as a practice owner and a group practice owner, I have to market this practice. They need clients, we need clients. And so there has to be this involvement and active engagement in social media. And then the idea of Google reviews that came up yesterday. So I just want to throw any of that out towards you and then open it up for anybody else's questions before we wrap up.
Okay. Well, I can only tell you how I deal with social media, and that is in my informed consent. Clients know that my social media is a place where I provide information to the public, and I hope you find it useful. So it's a one-way thing. They see my business page, but not my personal page. Now, I continue to, I talk with other board members around the country, our board. I track all these things and what boards are doing. And I can say this, telemental health, right? There is a something that's really important to know about this. And that is, I can speak for some other boards, but I'll just speak for George's today. Boards are now using screenshots as evidence in processing complaints. So we've been wondering about this whole thing. Can a client be violated digitally, right? The board is using screenshots. For example, I reviewed a complaint about 2 years ago. This is, after I came off the board. That was, they were mandated. I see a lot of licensees that the board has mandated into either therapy or supervision. Not a lot of therapists want to do that work. They're afraid of the risk and so on. But with this licensee, there was a chain of text messages that collectively drew a picture of grooming.
Mm.
So, as I always say this, your every utterance now is a screenshot away.
Mm.
Now, that said, that's all I'm doing now is telemental health. So it's not that it's not doable, but that there are certain things that one might not want to think about, or one might want to think about that just you might not have looked at it that way.
Mm-hmm.
However you do it, my every utterance is a screenshot away. And what am I looking at when I'm looking at a client on tele? I'm looking at a piece of glass.
Yeah.
See? So
that mindfulness of that kind of, we're just one screenshot away. So really kind of that protecting ourselves, protecting the client. And then the other part about the Google reviews, that's the hot topic where people are like, well, obviously, what is our code? It says, we can't solicit for those reviews. But at the same time, the way the world and the algorithm works, businesses can't get to a good SEO ranking without Google reviews. So it really puts therapy practices at a disadvantage. And when I look at other therapy practices and I look at their Google reviews, they're like engaging, going back and forth. Honestly, I feel like they're giving up some PHI too. And so it's really like, I don't know if that's something that needs to change in our code of ethics, or just kind of
Well,
thoughts on.
yeah. Uh, whether we're talking about tele or face to face or whatever, the fundamental problems don't really change in terms of ethics, right? And let's use your example of social media. Okay. On one end of the spectrum, it's not a good idea to solicit reviews. Now, let's say a client leaves you a Google review.
Mm-hmm.
I'll give you two different scenarios. You have a client who you've asked for a Google review from, right? In and of itself, it may not be problematic, right? But let's say that something happens, the relationship with this client becomes adversarial, and they want to file a complaint based on something else, right? Whatever. As many complaints as I process, I can't even come up with something right now. But they're filing a complaint. They're upset about something.
Mm-hmm.
What the public tends to do when they file a complaint, because a lot of times they're hiring counsel, they don't just say they were not competent to practice. They go through all of the ethics and they pull through and try and find everything, right? And then Deborah solicited a review from me, and I tried to take it down, and she responded to the review saying, is there any way we can work this out? See,
Mm-hmm.
this is why every case is different. So you can see how context is everything. And
Yeah.
about the everything being a screenshot away, an analogy I use is, imagine you've gone in for open heart surgery. They're taking a recording of it. And you go into have this open heart surgery. The surgeon opens up your chest and makes an incision in the wrong place, profuse bleeding. Nurse comes, cauterizes it. Surgeon comes back and makes the incision in the right place, sews you up, and the surgery is a resounding success. And the patient says, I'm going to sue you for making that incision in the wrong place. Say, your every utterance can be taken out of context now. So the way we relate and interact with clients has changed.
Yeah.
Almost have to be like talking to the media. You have to edit, right? You find yourself editing what you say, how you say it.
Yeah. In some ways, we need new guidance on this for this new world. And if you don't already have an ethics training and for social media and all of
I
this,
do.
you
I
do
do.
great. So
I
people
do. And like I
know that.
said, it's because the principles don't change. The principles don't change.
Okay, well, we'll put a link in the show notes because people need to go to that. We need that. Excellent. Does anybody else have any other questions for Eric before I ask our final concluding question?
I think when you say the principles don't change, um, does that present any certain challenges for, um, well, I'm thinking of the new administration. And I don't know if they have anything to do with our profession or not. Certainly seems like they got a hand in some of everything right now.
Mhm.
But I'm wondering if there is a possibility for them to create change for us, positive or negative.
It's the wild, wild west out there, right?
Yeah.
I get questions all the time about international practice.
Mm.
Are people doing it? Yep, they sure are.
Mhm.
What's the risk of getting caught? Probably pretty slim. Is it illegal? Yeah, it is. To practice in a country that regulates your profession and you're not licensed or certified to do it there. So
Mm.
Yeah.
I know maybe that didn't exactly answer your question, but uh, again, I would say boundaries, it by far is the most important aspect of ethics to have a grasp on.
Mhm.
Okay.
Advocacy work often will blindside us, but boundaries, really important. You can apply that across everything.
Yeah, yeah. I think that's a really good important point that you're making right there in terms of the advocacy and how that could blur, that could be a boundary issue because I think everybody, knock on glass, I don't want to say everybody, but a large amount of people who come to this field are doing so for, in some ways, love of humanity. They want to be of service. They want to help the clients. They want to see people heal and grow and things like that. And so to not know our own kind of limitations to that puts us at risk for those boundary violations. If we're letting clients call us on off hours, if we're meeting clients outside of sessions, even if it's not sexual, like these sorts of things, even though we're like advocating for the client, it really can get a bit icky,
Yeah.
get
Well,
murky.
this work isn't for the meek.
Yeah.
A lot of people would like to think that we just talk with people, right? But I think a really good concept to kind of just carry around in your pocket is this. Don't don't look at it as boundary violations as far as professionally how the architecture that you integrate into your practice.
Mhm.
Don't look at it as boundary violations. Look at it as managing boundaries.
Yeah.
Because if we've crossed a boundary, we violated a boundary.
Mm.
If a client encroaches on us, we violate a boundary. Why? Because we're responsible for managing the boundary. A client can't cross a boundary.
Yeah. Okay. Any other questions for Eric? All right. So, Eric, as you probably know, we ask all of our guests here on Geeky Clinicians podcast, what are your best hopes? What are your best hopes for the future of our profession, maybe as it relates to ethics, or just in general? What are your best hopes for uh, our clinical world in the future?
Preserving therapy as an art, as a craft, as a science. Because the public is being sold something very different.
Mm.
They're being sold that, well, you can text your therapist any time of the night. They'll talk to you about this and that, empty promises, the online platforms,
Mhm.
very much. But, so it follows preserving face to face the craft of therapy, because there are certain things that can't be taken for granted about face-to-face therapy. And that is something as simple as the movement of air.
Mm.
It's a lot there with the movement of air, which you lose doing tele, you know.
Yeah.
I believe that AI can do a lot of it. Let AI do it. So, a lot of it, because of the risk to us in some of these realms of therapy. Sometimes the situation where all we can really offer is, well, you're riding in your car, you're talking about something I think is kind of serious, and okay, all I'm going to say is, well, research says that couples can enhance their communication by such and such. Like, it's just kind of a CYA kind of comment. Well, AI can do that. Preserving the art and craft and science of therapy.
I love that, preserving the art and craft and science of therapy. I love that. And also, like you said, integrating AI to do some of the psycho ed, some of the basic stuff that we don't need to do in the sessions, because that's not the essence of the art and craft and science of what we do. So
If we don't embrace that
mm-hmm.
and pivot, you're not going to be in business.
Yeah. Oh man, I may want you to come back and talk more about that. We could do a whole another hour on that.
Oh yeah, yeah, yeah. I'd love to. Yeah, I'd be happy to do that.
Yeah, we'd love to have you back. Well, thank you so much, Eric. This has been a great conversation. So much wonderful content covered. All right, guys. Thank you guys for watching. Please remember to subscribe and share this video. And we will see you guys next time. Bye.